Hello everyone. So today we are going to start a video on anesthesia. There will be some more videos, but today it's just a collection of some random points here and there inside anesthesia, which will definitely help you in one way or the another. And questions are being asked on these points. So let's just start. The first is, where does the spinal cord end? So in the intrauterine life, it extends throughout the vertebral column, but in adults, so adult is A is 1, so the spinal cord will end at L1 in maximum number of cases. In some cases, it can end at L2 also. So you just have to remember A for 1. So in adults, L1 or L2 in some cases. In infants, it will be L2, L3. So adult was L1, L2, and then infant was L2, L3. L2, L3. Okay. And one another point is, where does the dura end? So the dura extend up to the S2 segment. This dura means do. So do is 2. So dura is S2. The next point, what are the structures which are passed by the needle in the spinal anesthesia or the epidural anesthesia? The words are different, but the pronunciation is same. So sealed, S-I-L-D. So skin, then subcutaneous tissue, then supraspinous ligament, then interspinous ligament, then L for ligamentum flavum, and D for dura mater. And then you already know this, DAP. So dura, arachnoid, and pia. Now, where is the CSF present? Between the arachnoid and pia mater. So the spinal anesthesia will be given at this level between arachnoid and pia. And if we are giving epidural, means above the dura. So you know the epidural anesthesia will be given above the dura layer, but between which two layer? So SILD, between L and D, ligamentum flavum and dura. So you just have to remember SS and sealed. This is the second point. Now the third point, on which questions have been asked, and it is very important too. The spinal needles. The spinal needles. So it can be either a dura cutting needle or a dura splitting needle. Dura splitting. So sprouts, the moong dal, when it sprouts, it will split. So white sprout, because when you split it, what you will see inside is something like this. White sprouts. So white say vita care and sprout say sprote. So dura splitting means white sprouts, vita care, sprote, vita care and sprote. Okay. Now dura cutting. You must have gone to barbecue where there are a lot of items kept at the table, and you can have all or none. So but obviously we are greedy, so we start tasting everything that is on the table, won't leave even a single thing. यार पैसे दिए क्यों ही छोड़ना. So we'll cut everything. So in barbecue we cut. So B and Q. B say we get Babcock and Q say we get Quinky. Babcock and Quinky. These are the two needles which are dura cutting needles. So just to summarize, we have the needle which can be either dura cutting or dura splitting. कटिंग में वी हैव द बारबेक्यू. ठीक है, तो हम बारबेक्यू में सब कुछ कट करते हैं. सो बी से मेरा आ जाएगा बैबकॉक एंड क्यू से आ जाएगा मेरा क्विंकी. देन टू स्प्लिटिंग. स्प्लिटिंग से आ जाएगा वाइट स्प्राउट्स. तो वाइट स्प्राउट से वाइटा केयर एंड स्प्राउट से स्प्रोटे. इट सेम्स डिफिकल्ट, बट if you revise it once or twice, it will be easy. And I'll suggest you, wherever you have written these topics, you can just add these points at the end of your notes or in a sticky note, so that you can easily remember whenever you revise. Then levels of block in the spinal anesthesia. Now if at a particular level it is having a sensory block, then 2 levels upward it is having autonomic block, and 2 levels below it will be a motor block. So ASM, autonomic, sensory and motor, ASM. And how will you test it? So the autonomic function you will test by cold or hot, by temperature basically, then sensory by a pinprick, and motor movement by toe movement, by checking the movement of toe. So ASM. So yes, that's it for today. It's a very small video, And in the next video on anesthesia, that is anesthesia 2 video, we will be covering IV anesthetics, IV anesthesia. And believe me, it is going to be very simple. All the drugs and every point related to that drug will be simplified, and I won't give any extra sentences or anything, because I know it is difficult to remember by those extra sentences for just every topic. So by the drug name itself, I'll help you remember the points. And I hope you like this video, and thank you very much. Keep studying and stay safe.